Hi everybody. So today we will discuss about chronic kidney diseases or chronic renal failure. It's a term that encompasses all degrees of diseases from mild to moderate to severe or even at risk conditions of kidney function. That means if the kidneys are not able to completely wash out your waste materials of metabolism from your body or from your blood, then that condition is called chronic. And if it persists for 3 months, more than 3 months, then it's called chronic kidney disease. So it's a worldwide problem, worldwide health issue, and the incidents are much rising. And along with that, poor infrastructures and poor outcome and high cost of the treatment all makes more problem than the disease itself. CKD is more prevalent in elderly population. That means who is above 60 to 65 years, and it is almost confirmed that around 30 percentage of diabetic patients who are having diabetes for more than 20 years are having CKDs. CKDs can be said as reduced kidney function or reduced glomerular filtration of less than 60 ml per minute per 1.73 meter square of the body. Normally, the GFR is a rate which is an estimated rate by estimating the blood urea, and other factors along with the rise and weight and height of the body. It's an estimated value. Normal values of GFR in normal person is above 90 up to 120 is the normal values. If the value decreases below 90, then we will say there is some sort of kidney problem in him. Or normally when staging of kidney disease is done, CKDs are done, it is done through estimating this GFR, glomerular filtration rate. Glomerular filtration rate and along with the urine albumin creatinine ratio is considered as a golden estimation for diagnosing GFR. GFR along with the urine albumin creatinine ratio is considered as a prime diagnostic factor for CKDs. So while staging, it is done with the GFR. So first stage or stage 0 or stage 1 is a normal stage with the GFR above 90 up to 120, as I have told earlier. And if it is below 90 up to 60, it is called stage 2, or it is called mild reduction in GFR. So some sort of kidney problem is there. And when it comes down to up to 45 or 59 to 45, that means third stage, and it is divided. The stage is divided into the third stage is divided into 2, 3A and 3B. When it that means the moderate stage is divided into 3A and 3B, and in that normally the GFR rate will be between 59 and 45. And if it comes down up to 30, that means 45 to 30, it is called a 3B stage. And below 30 up to 15 is called a severe chronic kidney disease. And below that means below 15, it is called end stage kidney disease, or it is a fifth stage of kidney disease. But the main thing is that usually the patients who are between stage 1 and 3 are mostly asymptomatic. So what happens is that CKD is mostly diagnosed in a later stage. That means it will be diagnosed between stage severe and end stage kidney conditions. Or, otherwise, or until that's normal proper screening tests are not done properly. And so, if the end stage disease is there, so many uh, so many symptoms will be there in patients. Mostly peripheral edema, your hands, your legs, foots will be swollen, and sometimes pulmonary edema will be there, and anemia is a main symptom. And so, due to anemia, fatigue will be there, reduced exercise capacity will be there, impaired cognitive and immune function will be there, your immunity will be tampered. So what happens is you will be prone for disease every time. So whenever there is a flu, there is a cough, then you are prone to get that very easily. The quality of life will be much reduced, and there is a chance for cardiovascular mortalities. Apart from that, skin manifestations like dry skin, normally the patients having kidney problem can be diagnosed from their skin itself. It will be much dry and flaky. And see, gastrointestinal problems like nausea, vomiting, diarrhea, all these things will be there at times. And erectile dysfunction, loss of libido in ladies, amenorrhea will be there. And platelet dysfunction tendencies will be there. They are prone for bleeding. If some wounds occur, then the chance of clotting will be reduced, and such symptoms will be there. Normally, this, as I have said, diabetes are the main causes of kidney diseases, chronic kidney disease. Many other conditions like hypertension and many autoimmune conditions like IG, nephropathy, and rheumatoid type of arthritis, SLE, etc. can also lead for this type of CKDs. Many congenital conditions like polycystic kidneys and some hereditary diseases like Alport's syndrome and congenital horseshoe-shaped kidneys and congenital absence of one kidney, etc., can also lead to this type of chronic kidney diseases. So, what are the diagnostic criteria, diagnostic tools for diagnosing CKDs? Normally, CKD is diagnosed from, as I have already told, two things are very important: blood and urine examination. In blood examination, we usually check the complete blood count. Among that, hemoglobin will be checked. And total count will total WBC count and total platelet count, ESR, etc. are checked, and also a renal function test, which usually tests the creatine, serum creatine level, blood urea level, blood urea nitrogen level, and also electrolyte levels are also to be checked in urine. Routine urine examination along with the spot protein, spot albumin, and urine creatine level. Urine creatine albumin ratio is also an important thing. And apart from this urine and blood analysis, other imaging techniques like ultrasound and MRI and even CT are sometimes important in the diagnosis of CKDs. Apart from that, renal biopsy is also a method to diagnose many kidney conditions, especially membranous nephropathy, Alport's disease, etc. So, coming to the treatment part, according to the modern medicine, when the CKDs are diagnosed and if the stages is between 1 and 3, medicines are there to control the kidney function. But when the stages is more higher in severe and end stage conditions, then dialysis is the option, and another option is kidney transplant. Here, Ayurveda have got so many important drugs uh, which are much good in controlling the kidney function. And even in moderate, mild to moderate conditions, we can even reverse the kidney to its normalcy. We have got treatment, medication, and also some Panchakarma methods like Vasti, Virejana. In Vasti, especially some sort of Vastis like Rajayavana Vasti, some Vasti like Vaishanta Vasti, Guluchyadi Vaishanta Vasti, etc. are here at Sri Rudra employed for normalizing the kidneys. When the stages are high, that means when the stage is more, that means in severe and end stage kidney conditions also we have got medicines for that, but reversal is almost not that much that much possible, but we can prolong the ultimate measures of CKD by Ayurvedic treatment. Shodhana therapies, especially as I have told, the Vasti and Virajana are employed here, along with some Rushna therapies. Rushna, like Podikiri. Podikiri is applying a quantity of powder, which are important in reducing the edema and also increasing the peripheral circulation, thereby reducing the hypertension and reducing diabetes and normalizing diabetes, etc. And also some plant-based diet is prescribed here. Mostly in CKDs, diet is an important factor which can control the CKD up to a greater level. Mostly here we employ a purely plant-based diet. Non-vegetarian is completely reduced from the food. So that if non-vegetarian is reduced, non-vegetarian, especially fish, meat, and even egg are reduced, but a completely plant-based diet, of course, part of this poultry will be included, especially ghee and milk in a meager quantity is given. And these and along with fruits and vegetables, which are much low in potassium and other phosphorus contents, and also much low in calcium and sodium. So sodium, potassium, calcium balance is well maintained in a plant-based diet. Salt, of course, is also given in a meager quantity, and such a diet, here we have a special kidney diet which is planned according to their it's a tailor-made diet which is planned according to the patient's blood picture and urine picture. So CKD, as I have told earlier, it is mostly diagnosed in a later stage if not done screening tests at time. So it's in my opinion, it should be a regular habit to undergo a kidney screening tests at times, especially if you are diabetic and hypertensive. Wish you all good health.